Okay.
And seeing them in the hallway, they were just happy and jovial, and they enter the classroom and they're depressed. Like, it's something that happened in my doorway.
Yes. Kids do tend to be, if you think about kids in general, they're kind of impulsive, right? So one minute they're thinking one thing, and the next minute they're on to something else, and the next minute, that's the way the brains are wired. So mood is similar. Their mood will change, less like an adult who will get depressed and sort of stay that way. Like I said, will just not have very many moments of good mood at all. You know, the kids might do that. They might look completely, utterly normal at one particular time, and then get depressed rather quickly. Now, typically, if it goes on and goes on and goes on, it's going to be, you're going to start seeing that spill over everywhere. But the other thing I will say is that they're diagnosing some of these things, because we don't have access to blood tests or scans or things like that. It's very difficult, and so if the doctor doesn't get the right history, or or the parent gives the history that there's depression or something in the family and things like that, there's a lot of things that can skew that physician into thinking it's depression, and maybe he's got it wrong. Maybe it's ADHD, or it's some other behavioral issue, some stress at home or something like that hasn't reached the level of depression yet. So there are a lot of possibilities, and that's the hard part. Does that make sense? Yeah. Nobody has seen anybody that's been treated for depression and looked differently afterwards? Looked more like their normal self and was better? Has anybody seen that? Okay. So I was going to say, hopefully you have, because otherwise I'm going to be, it's going to be like I'm making this stuff up or something. I can always tell you all the stuff that I see, and that's great and everything, but without you seeing that, that makes it a little hard for you to believe, probably. Yeah.
How do you say that ADHD or ADD haven't connected to depression yet? Are you saying that there is a connection there with those?
Absolutely. In other words, the question is there a connection between ADHD and depression?
Yes.
Is that the question? Yes, absolutely. There's a connection between a lot of these different brain illnesses can kind of go together. So anxiety and ADHD and depression, a lot of these things will go together. And it's sometimes hard to sort out, because what is one of the symptoms of depression? Trouble concentrating, trouble with memory. And in kids, I would say attention is not too far behind. I would think attention might be hard. It might be harder when you're depressed. So, because usually there's some stressor or something else on your mind that's contributing to that depression, and so it's hard for you to focus on your schoolwork and other things. So it's pretty hard to sort out. And again, not being a child psychiatrist, I'm certainly not an expert. I haven't seen thousands of kids that can tell you right away what this is or that is. But all my colleagues, you guys heard Susie Creer, Dr. Creer, at the end of last year talk about ADHD, and she mentioned that in her talk, if I remember correctly, that ADHD and depression go together quite a bit. So it's something to keep an eye on. I mean, certainly, if you have a child that has one or the other, kind of make sure you're thinking about those things. Okay, now, what happens? Let's say you go to the doctor. Let's say you start thinking there's some depression. What should the doctor do? Hopefully the doctor will take a good history from you. And he may do some blood tests, but he may not. The first time you see the doctor, he may right away know it's depression, and he may not be worried so much about anything else, thyroid or anything else. And it sort of depends, too, on the age. If I'm seeing an older person who's depressed, I tend to check more of the blood tests, like the B12 and the thyroid and all that stuff, a little earlier than I would in a younger person. But usually he'll do some history, a physical exam, and he'll do some blood work, okay? The key thing for you guys to realize is either if you're the patient or if you're going with a family member is that you'd need to have a family member there. Because depression kicks in kind of slow and kind of gradual, and sneaks up on you. So if you're the person with depression, probably you're not able to tell the physician what the history is as good as a family member might be able to. So be okay with your family member coming in if you're depressed. And if you're a family member, assert yourself with the physician a little bit. Make sure the physician hears you. That this is a 3-month thing. It started kind of slow and gradual. I wasn't sure what was going on, but now he's really starting to slip into being more irritable, and he's not really enjoying anything in life anymore. He's withdrawing to the house, doesn't visit with his buddies anymore, doesn't want to hang out with me and the kids anymore. He sleeps 14 hours a day now, and different things like that. You've got to let the physician know that, because then the physician is going to start thinking depression. Otherwise, he may completely miss it. So give the history. The other thing that's important is, has there ever been an episode before? You'd be surprised how many times I have to ask that from people. They won't just tell me, yeah, I was like this 2 years ago, exactly the same thing, and they used this, and this is what helped. They won't even tell me that, unless I ask, and then I ask, and finally I get that. But it surprises me. Why wouldn't you think to tell me that? So you got to tell the doctor that. It helps them. If something worked for you in the past, it might work for you again. The other reason that's important is because if you've had more than one episode of depression, do you suppose it's likely you might have another? Probably. I mean, the evidence is that the more you have, the more you're likely to have, and the worse they get each time. So my rule of thumb is if somebody has 3 episodes of depression in their life, that means it's pretty easy for them to get depressed. Remember the genetic stuff I was talking about? Maybe that's one of those folks. If they have 3 or more episodes of depression in their life, I think it's probably worth the risk of staying on the medicine for good to keep them out of that depression again. People might argue that, but that's what most psychiatrists and most doctors that treat depression feel, is the 3 or more episodes. And there are times where I'll even say, like, let's say somebody has a family history of depression, 2 suicides in the family. That's a pretty thick family history. That's a pretty scary illness in that family. If they've had 2 episodes of depression, not even 3, maybe just 2, I might say, guys, or Mr. Smith or whoever it is, you really need to stay on this medicine because your family history is pretty thick. It's pretty harsh. So tell the physician, how many episodes have you had? Did they look the same, and what worked? And family history, if there's a family history. Now, how do you treat it? There are different ways to treat depression. I'd say the first thing let's talk about is psychotherapy. Okay, you guys have heard of Sigmund Freud? Okay, well, we don't really do things like Sigmund Freud too much anymore. You can find somebody like that on the East Coast if you want to drive pretty far away. Most folks, I do some therapy or have done some therapy. Mr. Rogers over here has done some therapy. Therapists nowadays are more interactive. They'll sit there in a chair with you right across from you, and you'll talk. You'll tell them about things that are going on, thoughts that you're having, feelings that you're having, and they help you kind of process that stuff. Like one of the forms of therapy is sort of a brief type of therapy that's 10 to 12 sessions, and what it does is a lot of folks that get depressed, they have sort of automatic negative thoughts. I'm no good. Everything I touch is a failure. I can't do anything right. Everybody would be better off without me. These are all sort of common negative thoughts that people with depression have over and over again, okay? A therapist will help you to start challenging some of those thoughts because they're not true. If you ask your family that, they'd say, no, you're not a burden to me. I love you. I want you around. But the depression is what's making you think like that everybody doesn't want you around. So you got to challenge that, and that's what the therapy does. Now, the problem with psychotherapy is if you can't concentrate and focus very well, if you're more moderately or severely depressed, you probably should not just do psychotherapy alone. Certainly it's okay to start it and everything, but you probably need to start medicines and the psychotherapy at the same time. I think anyone and everyone can benefit from psychotherapy and probably should be in psychotherapy when they're suffering from depression at some point. Whether you start it right away or whether you start the medicine first, give it time to work, ease a little bit of the concentration problems, memory problems, so the person can focus a little better and retain what they're learning in the therapy sessions. There's some argument for doing that too. So either way, psychotherapy is probably a necessity in my mind. Studies have shown that it works with the medicines. It works better than either medicine or psychotherapy alone if you put them together. Medicines. Has anybody heard of antidepressants? Prozac? Anybody heard of that? Okay, are they speed? Anybody know? Is it sort of the same thing as cocaine? Does it get you high when you take it? No, it doesn't really. I mean, if you don't know that and you're wondering, well, how can you say that, doctor? Well, the easy way to do it without listening to me is just to ask around the streets. Hey, is anybody selling any Prozac? Hey, you got Prozac? Hey, I'll give you $100 for a Prozac tablet. You think you're going to get too many buyers or too many people around the streets that are asking to buy Prozac? Probably not too many. And Xanax, yes. I heard of Xanax out there. Yes, you are. And I'll talk about Xanax in a second. It's not an antidepressant, though. It doesn't do anything for depression. It helps anxiety, and it works kind of quick and fast, and that's why people like it. Prozac, does it work fast? Not really. It takes 4 to 8 weeks for some effect, 4 weeks. 8 weeks, you're starting to get 75% effect or so. By 12 weeks, you should have full effect of the dose that you're on. So it's a slow, gradual thing. It's not something that works quickly. And it's exactly the same with Zoloft, with Paxil, with Effexor, with Remeron, any of the antidepressants. That's the way they are. It's not a quick fix. And that fact, people struggle with that a lot. They want to come in when they're having pneumonia, they get an antibiotic, and they're better in 5 or 6 days. They don't want to come to the doctor, me, a psychiatrist, and say, Doc, I'm depressed, get me better in 2 or 3 or 5 or 6 days. I can't do it. I don't know how to do it. I can't. There's no way that I know of to get you better. Sure, cocaine, okay? But then you got a whole other problem, all right? Now you have an addiction. Well, you didn't need that, okay? And it probably wouldn't treat the depression anyway, it would just mask it. So the way the medicines work is that in our brains we have these chemicals. We talked about these a little bit last time. And these chemicals that are normally there, and normally their job is to allow the nerve cells to talk to each other back and forth, messages to go through and back and forth, okay? And they work in all different parts of the brain. But in the part of the brain that controls mood, these chemicals, the theory is anyway, that these chemicals get low. Why? We don't know. How they got that way, we're not sure. Somehow the stress or something does that to them. We don't know for sure. But these chemicals get low. So how does Prozac work in medicines like that? It actually allows you to, it blocks the recycling of those chemicals so that they don't get chewed up or sucked back up into the nerve cell. They can stay floating around out there and the message gets through a little better. Okay? That happens when you take Prozac, your chemicals in your brain go up within 3 days. Why does it take 10 to 12 weeks for full effect? Because it's not so easy. Depression is not just a chemical imbalance probably. What happens is you take the Prozac, it increases that chemical in your brain, serotonin is what it is if you're interested, increases the serotonin within a few days, but then that does something else, which then does something else, which does something else, and finally, 10 to 12 weeks later, you get better. What does the research show that antidepressants do besides just boosting the chemicals? What's the sort of the downstream effects? Remember the stress response system I talked about? Cortisol and all that stuff when you get chronically stressed by something. The antidepressants have been shown to dampen that system down a little bit. So that's one way they might work, is by eventually, ultimately, dampening that system down. They also cause you, believe it or not, to grow new nerve cells in your brain. When you take Prozac, remember the hippocampus I talked about with memory that shrinks, and with depression it shrinks? Probably some damage going on there. That's the only thing I can think of, and that's what we think, is that there's some damage. Whether it's permanent damage or whether it's just shrinkage of the nerve cells, kind of like when I lift weights and I get my muscles big and then I don't lift weights anymore, my muscles atrophy, right? They just go away. They kind of get flabby. The brain cells may do the same thing with the chronic exposure to cortisol and stress, okay? If the antidepressants make new nerve cells in that part of the brain, which they've been shown to do, that might be one of the ways they help depression as well. That's a little theoretical, but we definitely know they make new nerve cells in that part of the brain. And we know that that part of the brain shrinks. Definitely something there if you ask me. So are they illicit drugs? No. You don't usually use these medicines to abuse them. I mean, you just don't get high on them. There's no market for that kind of thing. They take too long to work. Do they make you a zombie? That's another one I hear a lot. I don't want to take that Prozac, Doc. It's going to make me a zombie, or it's going to make me go out and shoot people. Anybody ever heard of that stuff? I mean, I don't know. I don't want to put him on the spot, but I guarantee you that probably everyone in this room knows somebody who's taking something like Prozac. Whether if it's not Prozac, something like it, Paxil, Celexa. Are they all zombies? I mean, there's millions of people on this stuff. Do you think do we walk around and does it look like the Night of the Living Dead all the time in Hagerstown, Indiana? I don't think so. I mean, we don't have a town full of zombies, or 10% of our population being zombies. I don't think so. This stuff doesn't make you zombies, okay? Certainly if you overdose something or you combine Xanax, let's say, with high doses of Xanax with Prozac or something, Xanax is kind of sedating. That's how they work. They calm the brain down, Valium, Xanax, all those. They calm the brain down. And yeah, you might have somebody who just kind of gets so calm that they just stare. I mean, that they're just really calm like that. Prozac doesn't do that. But these medicines might. Yeah?
What's the downside of stopping one of those?
Excellent question. The question was, for the rest of you, is what's the downside of stopping an antidepressant? There's multiple layers to that question, okay? The first thing is we got to find out did the person benefit from the medicine? So did they have depression? and they started the Prozac or the whatever it is, let's do Zoloft, whatever. Let's say they started the Zoloft and they got better on it. Okay, are you wanting to know now what happens if you stop it? Okay, what happens if you stop it is that there is some risk of you getting worse again, but this is why it matters as to how many episodes you've had and things like that. So if you've had one episode of depression, my rule of thumb is I keep you on a medicine for a year. If you've had 2 episodes, I keep you on for 2 years. If you've had 3 episodes, what did I say earlier? You got it. Life. I mean, I don't mean to make it sound like like you're in prison or something, but if you have diabetes, you take a medicine and you have to take that medicine as long as you have diabetes, correct? If you have hypertension, high blood pressure, you have to take that medicine to treat that illness. We're not curing these illnesses with Prozac. We're not curing the diabetes with the insulin. But if you take the insulin, you have a fairly good chance of living a fairly normal life, doing the things like everyone else. So Prozac or Zoloft or any of these others, if you stop the medicine, the illness could come back. That's one thing. Some of the medicines, here's another part of your question, some of the medicines are kind of short-acting. Paxil is one, Effexor is another, Luvox is another. These medicines that are short-acting, they go into your body and your brain, they do what they're supposed to do, but then they start to come out kind of quick out of your system if you stop them cold turkey. And the result of that is you can have some withdrawal. Now, is it alcohol withdrawal or deadly kind of withdrawal? No, it's not like that at all. But it's more like a dizziness or an upset stomach, GI upset, headaches, things like that. It's uncomfortable. It's not good. I mean, if you don't have to have it, why? You shouldn't have it. So don't ever just stop the medicines. You should always, the doctors can help you, work out some kind of tapering schedule where you gradually lower it. And if the medicine didn't work and that's why you're stopping it, then you probably want to go ahead and try something else anyway. So what I do is it's a fancy word is cross taper. I lower down the one as I start slowly easing up the other one. That prevents any withdrawal and also prevents them from getting worse by coming down really low and then not having any medicine for a while because the new one's going to take a while to kick in. Did that answer? Okay. Yeah.
Does Librax fall in here anywhere?
Librax, excellent question. Librax is a combination of well, let me not give you the technical terms. It's a combination of Librium. You can hear the Librium. It's a combination of that, which it's a long-acting type of Xanax. I mean, Xanax and Valium and Librium, all those medicines are in the same class, and they're not necessarily bad. I mean, Librax is a medicine for irritable bowels, for folks that have overactive bowels, okay? And so it's a combination of Librium and a medicine that slows the bowel activity a little bit so that you don't have diarrhea and stuff as bad and cramping and all that. And some folks, they really need that. That's a good medicine for them. So that's what Librax is. The question was, what is Librax?
But what would be the side effects of, quitting that? Like if it's working and then you miss a pill, miss 2 doses or whatever?
The side effects or the withdrawal of any medicine, the easy way to think of this is the withdrawal of any medicine is the opposite of what it does for you. So if you cold turkey off a medicine that slows your bowel activity down, what do you think is going to happen to your bowels?
But I'm talking like emotional.
Might have diarrhea.
Emotional.
Yeah, so let's go to this. So let's talk about the other half of it, not the bowel part, but the Librium part. Interesting thing is Librium has a long activity in the body, in the brain. Okay? Xanax doesn't. If you stop cold turkey Xanax, it comes out really quickly, and you can have withdrawals from that. That could be deadly. I mean, you can die from Xanax withdrawal. Ativan withdrawals, another one, Klonopin. Some of these others that are real short, that last in your body a real short period of time or an intermediate period of time. If you cold turkey those, you can have seizures and ultimately die. And the reason is because if you've been on it for a long time at a high dose, and it's calming the brain activity down, and then you stop it and it comes out immediately. It's like you're driving your car. It's like you're putting the brakes on the car. With sort of your brain is like the car, and you're putting the brakes on with the Librium or the Xanax or whatever it is. Let's use Xanax for an example. Putting the brakes on with the Xanax, and your car kind of gets used to that. And used to you driving down at 55 mile an hour with the brakes on, where there's smoke flying out because you're burning up your brakes and rotors and everything. But still, you're able to go 55 mile an hour. Now let's say all of a sudden you just let off the brake, which is taking away the Xanax. That car is just going to go whoosh, right? It's going to just fly out. So in your brain, the equivalent of that is you start to get jittery, shaky, nervous, start to see things coming out of the walls, and then you start ultimately may have seizures and die from that. So that's the same as alcohol withdrawal. I mean, alcohol withdrawal is the same thing. It comes out of your body kind of quickly, and if you've been drinking a lot of alcohol for a long period of time, you're at risk for that kind of thing happening. So you should never cold turkey that kind of stuff. You always want to wean it if you can. And ultimately, it'd be nice if you could do that with a physician helping you. Yeah, go ahead.
Since you're talking about kind of stopping syndrome, what about Cymbalta?
Okay.
Are there a lot of side effects of like going cold turkey off of it?
Cymbalta is a fairly new medicine that's equivalent, in my mind, it's fairly similar to Effexor, but probably the withdrawal is not quite as bad as the Effexor. But still, it's always better, really, even if it's Prozac and it's got a long. I mean, Prozac lasts for weeks in your system. So when you stop that one, it kind of weans itself almost. I still would recommend if you're on 40 milligrams of Prozac that you cut it little by little before you stop it. Same thing with Cymbalta. I would do the same thing. So just to prevent it. I mean, why would, if you don't want to have dizziness and upset stomach and other stuff that feels terrible, why? I mean, really, unless you're having a terrible, most of these don't have terrible life-threatening type side effects. But if you had some rare thing like that, I suppose then you might want to stop it. But okay, I had another question in the back.
Yeah, if like you come off of Cymbalta and go on to something else, should you come off gradually? If you've been on like 60 milligrams of Cymbalta and go on something else, should you go gradual or?
Well, 60 milligrams. What's the lowest dose Cymbalta comes in? I think 60 may be close to that. Maybe the closest. I think it may be the lowest dose. If not, there may be only.
30.
Is there a 30? Okay, if there's because it's a capsule, right?
Right.
And Cymbalta. The question is again about Cymbalta is about how do you come off Cymbalta?
And go to something else.
And go to something else. Correct. Remember me talking a second ago about cross-tapering medicine, so you might lower slowly down on one and gradually increase the other one? I always recommend that you do that if you can. And so you might, like what I would do is just kind of give you an example. Let's pick a medicine for me to help wean. Let's say Zoloft. Okay. So Zoloft, I mean, knowing how it comes in 25 milligram pills and 50 and 100. And so what I might do is I might cut your Cymbalta like from 60 down to 30. If it comes in a 30, you got to make sure it comes whatever it comes in. I can't remember off the top of my head. If it comes in a 30, I might go to 30 and add the 25 of Zoloft. Do that for a week, and then I might maybe even come off of the Cymbalta and then try 50 of the Zoloft. So you see what I mean? You're kind of slowly coming off the one while you're slowly going up on the other. There's no absolutes in that. I mean, everybody's body's a little different. So some people, that might be too fast. In other people, it's not fast enough. So you have to work with your doctor on that a little bit. So please, anything I say in here, don't take that as gospel and go back to your doctor and say, hey, Dr. Henley said this and this. And the guy's going to say, Dr. Who? Who are you listening to? He's going to wonder who that quack is going around giving bad advice out. So, okay, so any other questions about the medicine? I guess the side effects wise, of course, I can't go through every single medicine and give you, all the side effects of all of them. That would take us all night. But suffice it to say that the newer generation of medicines tend to have different side effects than the older ones. The older ones were more things like sedation. There could be some heart risk. They were a little more dangerous if you overdose. You could die from the overdose of the old ones. And when I say old, I mean imipramine and nortriptyline and things like that. The newer ones, like the ones we've been talking about, Prozac, Zoloft, Cymbalta, if you overdose on those, they don't tend to kill you. So that's a good thing. So if you're worried about somebody who's suicidal, a physician is, that's why physicians are kind of more comfortable with the newer ones, is because they don't have to worry so much about that. But they still can have side effects, just that they're a little different. They may not be quite as sedating, so they don't make you sleepy as much. But although each one is a little different, so Remeron is kind of sedating. It's a newer one. But Wellbutrin is not at all. It's not sedating at all. Sexual side effects tend to be one of the most common side effects. And of all the common side effects that these newer generation of medicines have, it's really the only one that doesn't really go away with time. That one sort of sticks around. It's about 30 to 40% of people, depending on the studies and everything. And it sort of sticks around. I'd say I've seen some people after 6 months where it got a lot better and didn't bother them anymore. But for the most part, that's one that folks, that's the common one that folks complain about that doesn't go away. The rest of them, like nausea and headache and all that, they go away once your body gets used to the medicine, usually in a week or two. And they're not harmful in any way. trying to think of anything else about the medicines. Anything sort of general that I can tell you. Does anybody have any questions about the medicines? Oh, have you heard anything about antidepressants and kids and suicide and all that? The controversy about whether antidepressants cause suicide, has anybody heard about that stuff? Actually, the FDA has a warning now in the label for all the antidepressants, the newer ones, for use in kids, warning about the risk of suicide. Now, here's the difficult part. I'll give you this is my own thoughts on this. It's certainly not me only. I mean, a lot of the other folks in the field think the same thing. My own thoughts on this is that back to the question about diagnosing depression in kids. We didn't talk so much about this, but you can see depression in different types of psychiatric illness. You can see depression in just depression, major depression, or major depressive disorder, which are just folks that get depressed, okay? That's it. Or you can see it in bipolar disorder, where folks get depressed, and then on the other hand, sometimes they get manic, kind of the opposite of depression. Lots of energy, like they're on speed, but they're not on speed. They're just revved. Now, you have a child, and they're very young, so they haven't lived very long, and you haven't had a chance to really watch what their cycle of illness is, whether they've ever been manic or anything. Maybe they never have. Maybe the first thing you see is depression, and you think that's depression, regular depression, and you put them on an antidepressant. If they had a tendency, if they're really a bipolar child that has bipolar disorder, and you put an antidepressant on board, you might make their illness worse. So it's extremely difficult sometimes, and that even can happen in an adult as well. And yes, some subset of people, when you put an antidepressant, when you use an antidepressant with them, may end up killing themselves because they go into sort of a mixed manic and depressed state, which feels miserable and has a high risk of suicide. But anyway, the FDA, the studies that were done with these antidepressants, they try to look for that stuff, but as you can imagine, it's very hard. How do you know if they've never had a manic episode? So they used the antidepressants, and some of those kids committed suicide or had suicide acts. The warning really is more about suicide attempts than it is about completed suicide. Thank goodness, because I mean the signal, the safety signal, looks like it's suicide attempts more than it is completed suicide. In any case, there's a warning in the label about that, and what you're supposed to do is you start the antidepressant for the depression in the child, and you watch them very closely. You see the physician very often. The family or the parents should really kind of watch the child closely to make sure they don't start to see the signs. What it looks like, in the FDA warning, what it looks like is mania. It looks like where the child starts to get tons of energy, talks 90 miles an hour, irritated, irritable, agitated, that kind of stuff. Doesn't sleep. If that stuff starts to happen, then you got to really wonder if you got the right diagnosis, and you may need to get them off the antidepressant. So that's my own 2 cents about, do they cause suicide? I'd say if you don't use them in the right person for the right illness, they might. If you use it for the right thing, and part of it is you guys giving a good history to your doctors about what your symptoms are, and if you've been manic, for God's sake, please tell the doctor that. Most people who've been manic don't realize they've been manic unless they've seen somebody for it or something. And even then, still they don't sometimes agree that they've ever been manic. To them, it feels normal. It feels pretty good to be manic. And we're going to talk about bipolar disorder. I'm going to have a whole talk on that, a whole hour on that. So we'll talk more about it at that point. But any questions about it? I hope I did explain it fairly well enough. Make sense? Okay. The last thing I just real quick wanted to talk about was ECT. Have you heard of ECT? You ever seen One Flew Over the Cuckoo's Nest? ECT stands for electroconvulsive therapy. And I want to just say a word about that, because one of the things I know that Tom Cruise talks about all the time is how violent, how evil, and everything psychiatrists are. I guess he thinks that we have some agenda that we want to control the world. I don't know what it is. I don't have any agendas like that. One Flew Over the Cuckoo's Nest shows Jack Nicholson getting ECT. And in those days, when they did ECT, which is an electrical stimulation that they put through the brain, it causes a seizure, he was awake. I mean, the folks were awake back in those days. Now, it is an effective treatment, and it does treat depression, but they don't do it in folks who are awake now. We do this under anesthesia. So you go in just like you were going to have some kind of outpatient surgery. You get put to sleep. There's a mask that they use for you to breathe into, and the anesthesiologist breathes for you with the bag thing. And they paralyze the muscles so there's no shaking. You don't shake or any of that stuff. You're basically asleep, and they give the electrical stimulus, and you do it 3 times a week, and after usually about 2 weeks, 6 treatments, it's the most effective treatment for depression that we have, bar none. I mean, better than medicines even. And I've actually saved people's lives with that. And I can tell you a story about that if you want, but go ahead, you had a question?
How does that affect the brain at all times? A friend has had a stroke, but he's